is Jenny Whitener, and I'm the founder of Bridge Innovate. Today, we have a very special guest with us on our Leaders in the Arena series, focusing on AI in healthcare. If many of you know, the Leader in the Arena series is sponsored by Bridge Innovate, and we focus on empowering teams to lead, think, and problem solve differently. We do that in a lot of different ways through our consulting services, our future lab design sprints, our leadership and learning programs, and we have a pretty cool studio if you just want to come hang out with us and create some big new ideas. But today, the really important news is that we have Danny Fell with us, and he is the Health Systems Practice Lead at Unlock. He's going to be talking with us today about AI and healthcare marketing, a very important topic. So the early stages of AI making huge difference in healthcare, and I know that he'll be talking about that and how that's empowering a personalization in the patient journey. So Danny, thank you so much for joining us today.
Jenny, thank you. And it's great to see you.
It's great to see you. I mean, I know that in terms of talking about your introduction just a bit, so I want the audience to get to know you, right? We first met, I guess, back in the day when you guys were doing some strategic planning, it sounds like, and you came to the Bridge studio.
Yeah, your first studio. We brought a client in. We did I think a day or a day and a half. Great space. Your new space is even better. I'll share with folks where you are now. Is wonderful, and I've worked there too, more on the nonprofit side. But yeah, that's where we first met, I think.
It was. And then after that, I think we did some work together. You're on the board of WTCI, the PBS station affiliate here in our region. And we had a chance to work on that project together, doing strategic planning. So one of the things that I know that you are well known for is being a leader in the healthcare space, but also a leader in giving back. And so first, I just want to say thank you for that. And leading and all across those dimensions. Help the audience know a little bit more about your background before we jump into today's content. That would be helpful. Give us a little bit of a bio.
Yeah, sure. So first of all, I live in Chattanooga. I spent a lot of my time traveling, but have been there for a long time and actually came there right out of college to work in the healthcare industry in marketing with an agency. And that's really where I started my career, my whole trajectory in healthcare and marketing and business, and have stayed there since. And that's where my family is. But the bulk of my career has been in the healthcare, in and out of the healthcare space, working on the agency side primarily with consulting and agency work, a little bit on the provider side, and then I spent about 4 years, right about the time COVID was happening. I was at one of the largest healthcare companies in the world, United Health Group and their Optum division. So we can talk more about some of the work I was doing there related to AI. But yeah, that's a little bit about my career.
Right. I know that we have a common background a little bit in healthcare, and that was some of my early beginnings with Kaiser Permanente and Prudential Healthcare, and near and dear to my heart. So, and to all of us really as consumers and as humans, right? Healthcare touches all of us.
Yeah, I like to joke with people that all roads lead to healthcare. So
Right.
even in those times when I've worked in other industries,
Right.
we all had some healthcare related focus. So
Right.
yeah,
So
sure.
if there's going to be an economic downturn, you're either going to be in the healthcare market or maybe in beer. I don't know, but one or the other, right?
Yeah, well, of course, it's different today. You know, it used to be healthcare was one of the more resilient industries, but I would say for a lot of different reasons, the healthcare landscape looks a little bit different today, and it is more challenging. But yeah, traditionally that's been true.
So one of the things I've heard you do different panel discussions and keynote discussions where you are really pushing people to imagine and to really be aware of how AI and emerging digital technologies are influencing healthcare. And I hope you can help us illuminate us a little bit in that space today. Talk a little bit about how AI, give us the landscape about how AI is being used in healthcare today. And then I'd like to go a little deeper into some things like the Marketing Toolkit. But first, just give us the broader landscape.
Yeah, so I'll start by saying I have been fortunate, I'll show my age a little bit, to have lived through the early internet, World Wide Web.com days. And there are a lot of similarities to what we were seeing technologically, the changes and the evolution happening really with computers and desktop publishing, but then certainly with online A lot of parallels to what we're seeing today with artificial intelligence. And I'll specify today's AI versus AI that's been around for decades, and we'll kind of tease that out. But there are a lot of similarities. The big differences being, I think this technology is moving much faster. We're seeing much more rapid evolution of the technology as well as adoption of it. And so that's something that's a little bit different maybe from what folks were living through in the 90s. And again, I would differentiate between AI that's been around again for decades, machine learning and algorithm driven AI that was used and still used today for a lot of different things, including predictive analytics and data analysis and things like that. The newer technology that mostly people think about when we talk about AI today is the generative AI. So Gen AI, and then more specifically or more recently, some of the agentic AI that's happening. And so that is really exciting. It's scary for a lot of people. Frankly, it's scary for a lot of businesses. I'm in Las Vegas next week, keynoting a presentation at a national healthcare conference where we're talking about, how is this working at an enterprise level? And I have some great folks on my panel talking about what's working, what's not, why it's hard for organizations to implement AI across the organization or across the enterprise. So a lot happening. It's very exciting, and it's hugely important in the marketing space as well.
Mhm. Right. So talk a little bit about that. AI is accelerating in healthcare and healthcare delivery. It's impacting, I would assume, the consumer's experience, the patient's experience, the provider experience. Even the patient themselves are now have access to information, to data, to resources and analytics that they've never had access to like they do today, to be really a companion with the provider in exploring their healthcare. And then also then how the delivery system of healthcare is enabled by AI. Talk a little bit more about that, and then let's get into how marketing and branding is making a play in that space.
Yeah, sure. So let's start with the healthcare landscape first, and talk a little bit about how AI looks across the healthcare continuum. I would break it down into maybe three buckets, right? There is the clinical applications, and that can range from things like drug discovery to the integration of AI into some of the electronic medical records and prompting physicians and practitioners around clinical recommendations and decision support. So that's the clinical side. There's the operational side, which looks probably a lot like any business, right? So HR, sales, marketing, back office, supply chain, purchasing, all the things that you would expect that is sort of running healthcare and it's very important. There's all that operational opportunity with AI to make things more efficient, to reduce errors, to track compliance, which there's a lot of compliance in healthcare. So there's a lot of applications there from a business perspective. And then the third, I would call experiential. And I think when you think about technology and how humans interact with different technologies, there's a very important user component there, the user experience. And that can play out a lot of different ways. And it's not just related to consumers and patients. It's actually the experiences of the physicians and the caregivers and the healthcare professionals as well. So one of the great examples that I give in healthcare is something called ambient listening, where we're using AI, healthcare professionals are using AI to record interactions in the healthcare settings. Typically, a good example would be a healthcare practitioner, a nurse practitioner, or a physician or a nurse working with a patient, as opposed to today, what happens a lot is the practitioner is expected to be logging information into the laptop, right? Recording what's happening. Now with ambient listening, with AI listening and recording and catching everything, the practitioners can be face to face with the patient. And they can be listening more intently and following along and giving visual cues and making the recording of the notes and the coding that happens behind the scenes. That's how healthcare gets paid, coding. All of that can be done by AI in a more subtle, sort of behind the scenes fashion. And we now actually have evidence-based medicine. This has been published in the Journal of AMA and others that is seeing the results of using ambient AI in reducing errors, in improving efficiency, and reducing time spent entering all this paperwork or computer work, something the healthcare industry calls pajama time, which happens in the evenings, right after hours. So we actually have evidence to show that ambient listening is effective, and that's just one example. But it also cuts across all those three buckets I talked about. It's clinical in nature in that it is actually capturing and recording clinical notes in the EMR most often. It's experiential for the patient, for the caregivers, for the office staff, and it's also operational because it is filling a very important role in terms of documentation and recording. So that's just one example of where AI is being used effectively in healthcare, and we're actually seeing really good results from it.
In your opening remarks, you talked about acceleration and how fast this is moving. Just that example that you've just shared now, like I see huge benefits, right? Huge win for the patient experience, huge win in terms of potentially impacting clinical outcomes, huge win, like you said, in terms of operational efficiency and managing costs associated with healthcare. So you're like, this is great. Like, how do we scale this quickly? How do we move fast? What are the major barriers to adoption? What are the major barriers to scale? How do we do
There
that?
are, yeah, there are a lot of barriers and a lot of concerns. And before I jump into some of those, I'll cite a couple of statistics to give folks a feel for how fast some of this is moving. ChatGPT, which is OpenAI's large language model or their AI product, and there are many out there, right? So I'm just giving one example. They happen to be the largest. It took Facebook about 4 years to reach 100 million users. For ChatGPT, that happened in about 2.5 months. So you can see how rapidly that technology, and by the way, about 75% of their users are consumers. We think of it as personal or home use versus the workplace. Now, the bulk of the work is being done in professional settings, in other words, the volume. But in terms of actual users, we're now tipping the scales to where we have more personal or individual users outside of work. Another data point is that ChatGPT has been growing at about 6 times the rate that Google was growing when it came out. Now, Google is still much larger. The vast majority of searches still take place on search engines like Google. Something like 95% of them still happen there. But the speed at which and the growth that we're seeing with these large language models used as search engines, used as research tools, you alluded to the companion part of it, which we can get into, has just been phenomenal. And so I think that is fueling use your words, sort of the anxiety and excitement about how do we move faster, right? How do we get this into the hands of whether it's healthcare professionals or consumers or patients or marketers? How do we do that, and how do we scale? I think several things are holding back what's happening. One is it's happened so quickly that there aren't a lot of guardrails and clear boundaries for the technology use itself. Companies, nonprofits, for-profits, private, public companies are still grappling a little bit with how do we make sure we build in safety guardrails? How do we make sure we build in standards and protocols for how we use this with our company or how we use this with customers? There are big concerns about data privacy and sharing. I think the last statistic I just saw was there are something on the order of about 260 AI laws in 46 different states right now. You've got federal guidelines that are all at different stages of evolution. And so there's a very healthy and reasonable expectation that we want to use this technology, but we also want to do it in a safe, ethical, compliant way. And in healthcare,
Right.
those are huge hurdles, right? There's a
Right.
lot behind the compliance side of it. And so that's part of why it's probably evolving slower than some would like, and it's probably moving faster than others would like.
Yeah, I'm really glad to hear you talk about that because I think in the early stages of AI, whenever we would be using it with our clients, people were always going to accuracy, like, okay, this is really exciting. I'm getting this data, I'm getting this analytics, I'm getting this, machine learning capability. But do I trust the data? Is it
Mhm.
accurate? And then there was this whole ethical component. And so you had not only the acceleration happening and the critical thinking and the analytics and even the ideation, the future scenarios, or all the aspects that you would get from generative AI, but then the question of accuracy and the question of, like, is this ethical? So what I'm hearing you say is that those are still the major decisions, and that while the opportunity is there to scale, that rightly so, organizations are taking it at a pace where they can bring in those questions to look at accuracy and the impact on that, and then also to look at the ethics of it, because it's your healthcare, right?
Yeah.
It's people,
Yeah.
they want to
Yeah.
make sure that those things are happening.
Sure. And I think the other thing that's sort of happening at the same time is AI is getting integrated and implemented with every tool we use. So we're on a Zoom call, there's AI embedded in that. If you're using a CRM tool like Salesforce, a customer relationship management tool, it now has AI embedded in that. If you open a Word document and go to write an email or go to write a recipe, it's got AI implemented into that. So at the same time, at the same time, we're trying to build enterprise applications and look for where to invest in big things. It's also happening all around us. And again, that creates both excitement and interest and opportunity, but it also creates a healthy level of anxiety and maybe hesitation around, exactly what's happening and how is this evolving. So yeah, it's a very interesting time. And again, parallels to some of the stuff we saw with, the early World Wide Web and .com, but in
Sure.
some ways very different and even more pervasive.
Right. What advice do you have for leaders? I mean, this might take us a little bit beyond healthcare, but I think, from everything that I'm reading and seeing, healthcare is just a huge surge early adopter in this. So,
Mhm.
what advice do you have generally for leaders who are looking at how to master and become familiar with their potential with AI and how to engage their own organizations to take advantage of this capability?
Yeah, so I should probably caveat healthcare has not always been the fastest to adopt new technology, right? Certainly on the clinical side, research, drug discovery, absolutely. Maybe not so much on the operational or the institutional side. Healthcare has tended to lag other industries. But what's really interesting, there's some new research out by JP Morgan that is looking at smaller healthcare entities. I think the range they used was 500,000 to 20 million in revenue, which is relatively small in healthcare today. That's your physician practices, that's your clinics, your rehab centers, your PTs, things like that. They are now actually the number one user of AI and adopting AI. So we're seeing not only a shift in what's happening, but also tremendous penetration and adoption in the healthcare industry at certain levels. So that's just an interesting kind of recent data point. Your question was how to help leaders and organizations. I think one is education, like this, the what you're doing today, right? Just exposing people to the conversation, getting them into the conversation, and then from there, hopefully, beginning to experiment with some of these tools, begin to use them themselves, whether they're using them personally or professionally or a combination.
Mhm.
A lot of companies haven't completed what I would call a full AI audit. Like, where is AI actually implemented in your institution today? A lot of businesses would probably be surprised. Again, AI is showing up all over their companies, right? In the software tools that you use, the business tools. So, doing that audit to understand where it's being used, what vendors, what partners, what implementation tools. And again, you could take this at a company-wide level, you could take it down to a departmental level. If I'm working with marketers, I'm saying the same thing. audit where AI is being used in marketing, in your department, with your different tools. Some marketing, again, going back to the machine learning that has been around for a long time. We've used it for predictive modeling. We've used it for programmatic media buying, which is digital media buying. That's very heavily influenced by AI, traditional AI or machine learning AI. The newer AI is being used in different ways. So doing those audits, doing that education, and then beginning to build out whether it's pilots or a leadership team, a task force that can help the organization move forward, but also at the same time make sure folks are compliant with what the organization's business practices are, their mission, their particular legal, privacy, security regulations, things like that. And that varies by industry, as you would imagine.
Right, right. I can see that. So I'm hearing you talk about doing an audit. I'm hearing you talk about putting together like a community of practice, a leadership team that's going to be an explorer type capability, doing pilots, and then looking at what would be our standards of practice. What are our guidelines? What are our operating procedures in the use of AI and how we plan to use that? It's almost like an ecosystem of a business plan.
Yeah, oh, yeah. In fact,
What's
yeah,
our vision? How do we enable it to our customer side, go to the brand and marketing and the customer intimacy side? What does it mean to our back office systems? What does it mean to our revenue capability? Everything.
it's all the work that you do at Bridge Innovate, Jenny. It's change management, it's leadership, it's strategic planning. It's really not about the technology itself. It is about the technology, and AI is certainly unique and different. But we've been through this with other technologies. We've been through this with other evolutions. It is really more of a change management, I believe, more of a change management challenge than it is per se an AI challenge. But again, even how we think about AI and how we're interacting with AI has changed dramatically in just a couple of years, right? To your point about the accuracy, the tools today, the LLMs are way more accurate than they were, 12 months ago or 24 months ago. We're thinking differently about aspects of AI. So I'll give you a really interesting example from healthcare again. Hallucinations are typically thought of as being the negative side of AI, that the fact that these models, these algorithms would hallucinate. I heard an interesting perspective from Dr. Eric Topol. He leads the Scripps Research Center out in California, very active in obviously medicine, but also technology. He said that in some areas, hallucinations are actually a benefit and not a negative. So if you think about drug research, speed to market, hallucinations in that sector can actually lead to new discoveries. And so I thought that was a really fascinating perspective on something that we just sort of assume is a negative, but in fact, it could be a positive. So just one example, but how we think about AI is continuing to evolve.
Yeah, absolutely. And it's not in the sphere of hallucinations, but it reminds me of some of the work we're doing in leadership development and in some of our future lab sprints, where in leadership development, we try to take building new leadership skills, make that as close to the business as possible so there's immediate application of the skill. So a lot of times we're saying, okay, let this hypo group create the next level of the strategy or the next level, new market opportunity. And so they're going to go and do a competitor analysis. So now they're using generative AI and they're so into it. They're like, they had no idea how quickly they could get this competitive data because during the day they're doing their operational role. But then all of a sudden, there's this huge illumination of what could be. And then we're like, okay, well, where's the opportunity? Why don't you brainstorm with AI? Why don't you ask it to create a prototype? Why don't you ask it to create a new user experience? And so quickly, they're completely drawn in. It's really not the same as a hallucination, but they are completely drawn into a future scenario that they have just built in the last 30 minutes, right? And then they can begin to analyze that in a different way, bringing the human perspective if that's where we want to fit as a brand. Is that what our distinctive play will be in terms of a business? And what do we think about that? And then going back and using AI as their companion to help them analyze that.
Yeah, that concept of a companion is a great one. The idea, I think, of these large language models and the AI tools like ChatGPT simply being a newer, better version of Google is not the right way to think about these tools. Certainly, you can go ask it a question, you can do a search. I do that all the time. If I'm in the car, I use an application that Reid Hoffman built called Pi. It's kind of a personal AI assistant. And oftentimes I'll just start asking questions. We'll have a dialogue about something in part to stay awake, right? But when we start to think about it as actually a companion, a coworker, someone or something that is going to be there who has persistent memory, who can come back to a conversation, who can iterate ideas, that's where you're starting to really tap into the strength of generative AI and
Mhm,
some of the tools that we're using for sure. Yeah.
mhm. Great. You just mentioned an example of Pi. Do you have any other tips on applications that you're using?
Yeah, so there was just a great article in, and I apologize. I want to say it was like either one of the Mac publications or PC publications about customizing your AI tools. If you go into ChatGPT under settings, there's actually a lot of different ways you can customize. You can customize the voice. You can tell your application what industry you work in, how you like to receive answers. Do you want long, drawn out answers? Do you want short answers? Do you want high creativity? So personalizing these tools is something that a lot of folks are just now discovering. You don't have to sort of take the off the shelf. Obviously, companies themselves, when they're uploading private information, brand standards, they're customizing the content to fit that particular business or that particular industry. So there are lots of ways to adapt these tools to make them more useful, and personalization and customization is one way to do that.
Yeah, we have actually at Bridge, we have created a chat GPT called Wilder. It's named after John T. Wilder, but it is infused with all the elements of design thinking, right? And some of the
Love
best
it.
methods
Yeah.
of innovation to help you think even bolder. So we have a question that came in. I know we have a few more minutes to talk, but one of our guests listening live today is a question. I'm going to see if I can just read that off to us here. She said, "Thank you for speaking to the importance of internal alignment and the vision on AI use and adoption. Would love to hear how to overcome healthcare consumer fears or concerns about AI leading their healthcare journey. How do we help demystify AI's integration and show that there is still a human involved?" What are your thoughts there?
Yeah, so first of all, that last phrase, human involved, or sometimes you hear a variation of that, human in the loop or humans in the loop. That's a really important concept. That this is at the end of the day, we're still talking about humans and a tool or a technology, not something that necessarily is replacing how we do business and how we think. So I think keeping humans at all levels in the process is super important. Interestingly, I was just reviewing, there's a working paper out from some folks at Harvard and Duke around how ChatGPT is being used globally, and it has very specific statistics on professions and use and questions and things. Not surprisingly, health, wellness, beauty, which is a category, is one of the top uses in ChatGPT. And again, I'm careful to say that's just one of the LLMs, right? Folks are using Anthropic and Claude and others. So we know that healthcare consumers, roughly about 30% of consumers in the US, 30 or 35, depending on what number you're using, are using some type of AI tool. A large percentage of those are using it for health information, it's AKA, going to a search engine and searching for symptoms or treatment options. But they're also using it in different ways. We're actually starting to hear anecdotally and have some evidence. Consumers are uploading test results. They're uploading their own electronic medical record. They're asking the AI to go deeper, to offer suggestions, to prepare them maybe for a follow-up visit with a practitioner. We're starting to see them create companions. I'm going to use your word, custom companions to help in caregiving. If you're in the audience and taking care of kids or aging parents, it's incredibly time-consuming, complex, hard to navigate healthcare to begin with. And having a caregiver companion that is AI that can keep track of things, that can prompt you, is a really interesting application. So I would say that the answer to that question is, again, obviously education, pointing to the transparency of what you're doing, what you're using, how you're using it with patients and consumers, being very open. Physicians who use ambient, who I know personally, they're very careful to say, look, I'm turning on this AI and here's why. Here's what I
Yeah,
use it for. And they're saying from again, anecdotally, they're saying patients really like that they're getting the personal attention
yeah.
and that there's a tool there that's capturing all the details and things. So I think those are some of the ways: communication, transparency, education, to help consumers and patients alike around the use of it.
Great. Well, today you've done a great job helping us understand healthcare and how AI is coming together. But before we wrap up, I wanted to give you an opportunity to help us understand what's going on at your role at Unlock. And, what are the things that you're bringing to the table through your role there that you would want our audience to know about today?
Yeah, thanks. So let me speak to Unlock first. Unlock Health is a Nashville-based company that is new in one respect. We spent the last 2 years bringing together some of the best in-breed agencies, companies, consultants from around the industry, and that's in marketing and advertising and branding and digital marketing and consumer tools, a wide range of marketing, communication, planning, consulting capabilities under one roof, known as Unlock Health. My role as the health systems practice lead can kind of think of as two components. One is keeping my pulse on or my finger on the pulse of the healthcare industry, what the current state is, which a lot of folks know there's a lot going on, what the trends are, what's working in healthcare, how we're thinking about consumer and patient engagement. The other part of that role is working with our own internal teams and our clients to maximize what they're doing. How do we help them become more efficient with their marketing dollars, more successful, return a better value and investment to the organization? And so taking that view of the industry, as well as some of the best practices, and just making things work better. And really, at the end of the day, it's about how do we improve healthcare for patients and communities, and at the level of the mission of a lot of the organizations that we work with.
Great. Well, thank you. And thank you, Danny, I know that you have so much going on, but thank you for spending time with
Of
me
course.
today and sharing your story. How can people stay in touch?
Yeah, so thanks if you tuned in to the live recording or the recorded version of this. Thank you, Jenny, to you and Bridge Innovate for inviting me on. LinkedIn is probably the easiest way, just to hit me up on LinkedIn. I think it's under Daniel Fell. Happy to answer questions, share resources. If there's something I mentioned you're interested in, I can point you to a resource or maybe some further reading. So always happy to do that. Always great to be together with you, Jenny, and I look forward to seeing you back in town.
Thank you for being on Leaders in the Arena and being a leader in the arena. Thanks, Danny. Have a great afternoon.
Thanks, Jenny.
Okay, bye.